Hello class. Today we will be talking about Addison's disease. This disease is characterized by an underproduction of steroid hormones in the adrenal cortex, which is primarily caused by an autoimmune disorder but can also be caused by tuberculosis and metastatic cancer. Adrenal glands lie on top of your kidneys, and they are responsible for the production of cortisol and aldosterone. Cortisol is a key player in the body's response to stress. It can also control blood glucose levels through a process called gluconeogenesis. It can help metabolize fats, proteins, and carbs, and it helps with regulating electrolyte levels. Aldosterone helps regulate blood pressure by the way of renin-angiotensin-aldosterone system, and it also is responsible for retaining sodium and secreting potassium. So because Addison's disease is the result of the hyposecretion of these hormones, you will see patients presenting with signs and symptoms including fatigue, weight loss, anorexia, hyperpigmentation, hypotension, hypoglycemia, nausea, vomiting, and diarrhea, muscle and joint pain, irritability, and depression. Diagnostic testing includes checking cortisol and aldosterone levels in the blood and the urine. If there is adrenal insufficiency, then levels in the blood and the urine would be decreased. Some other tests would include ACTH serum levels and ACTH stimulation. ACTH is short for adrenocorticotropic hormone, and it is secreted by the anterior pituitary gland when cortisol and aldosterone levels are low in the blood. Someone with adrenal insufficiency would have higher than normal levels of ACTH because of extremely low levels of cortisol and aldosterone in the blood. ACTH stimulation tests are performed to assess adrenal response to adrenocorticotropic hormone. A patient would be injected with adrenocorticotropic hormone and monitored for secretion of hormones in the adrenal glands. Insufficiency would be confirmed if cortisol levels failed to rise. Adrenal insufficiency can also be checked by obtaining electrolyte levels. Aldosterone is responsible for the secretion of potassium and the retention of sodium. So if you have low sodium levels and high potassium levels, then this would confirm that diagnosis. You can also perform CT scans and MRIs to identify causes other than autoimmune, including tumors, fungal infections, tuberculosis, or adrenal calcification, and you can also perform an ECG, which will show low voltage levels and peak T waves caused by hyperkalemia. Treatment of Addison's disease includes daily glucocorticoid replacement. This can be found in medications such as prednisone and hydrocortisone, which are corticosteroids. These also help with the replacement of aldosterone and cortisol. So because these are corticosteroids, there's some nursing considerations, and these include taking it exactly how it's prescribed, preferably with a meal. You would never want to abruptly stop taking this medication. You would want to monitor glucose levels, reduce stress, exercise, and change positions slowly. Some side effects to these steroids include hypokalemia, muscle weakness, change in mood or behavior, hypocalcemia, delayed healing time, increased risk for infection, increased blood pressure, decreased protein, and increased risk for fractures. Now, alongside these corticosteroids, treatment can consist of salt additives, because if you remember, aldosterone was responsible for the retention of sodium. And if you don't have enough sodium, you may need to be taking an extra, especially for situations of excess heat and humidity. Also, remember that cortisol was responsible for the body's response to stress. So in stressful situations, you may have to increase your doses of cortisol.
Buffalo gals, won't you come out tonight? Come out tonight, come out tonight. Buffalo gals, won't you come out tonight? Dance for the light of the moon.